Welcome to NSG 229 Study Session 5 Common Behavioral Problems in Children. Introduction. Children display different behavior traits while growing up. Did you suck your thumb while growing up? Or do you know anyone who did? Thumb sucking and many other common behavior problems will be discussed in this study. In this study session, you will learn about psychosocial disorders, habit disorders, anxiety disorders, and sleeping problems. Learning outcomes. At the end of the study session, you should be able to 1. Discuss psychosocial disorder. 2. Explain habit disorders. 3. Discuss anxiety disorder. 4. Discuss sleeping problem. Psychosocial disorders. A psychosocial disorder is a mental illness caused or influenced by life experiences, as well as maladjusted cognitive and behavioral processes. The term psychosocial refers to the psychological and social factors that influence mental health. Social influences such as peer pressure, parental support, cultural and religious background, socioeconomic status, and interpersonal relationships all help to shape personality and influence psychological makeup. Children and adolescents with psychosocial disorders frequently have difficulty functioning in social situations and may have problems effectively communicating with others. Psychological disorders are manifested as disturbance in emotions, e.g., anxiety or depression behavior, e.g., aggression, physical function, e.g., psychogenic disorders, mental performance, e.g., problems at school. This range of disorders may be caused by a number of factors, such as 1. Parenting style, which is inconsistent or contradictory. 2. Family or marital problems. 3. Child abuse or neglect. 4. Overindulgence. 5. Injury or chronic illness. 6. Separation or bereavement. The child's problems are often multifactorial, and the way in which they are expressed may be influenced by a range of factors, including developmental stage, temperament, coping, and adaptive abilities of family, the nature and the duration of stress. In general, chronic stressors are more difficult to deal with than isolated stressful events. Children do not always display their reactions to events immediately, although they may emerge later. Anticipatory guidance can be helpful to parents and children in that parents can attempt to prepare children in advance of any potentially traumatic event, e.g., elective surgery or separation. Children should be allowed to express their true fears and anxieties about impending events. Young children will tend to react to stressful situations with impaired physiological functions such as feeding and sleeping disturbances. Older children may exhibit relationship disturbances with friends and family, poor school performance, behavioral regression to an early developmental stage, development of specific psychological disorders such as phobia or psychosomatic illness. It can be difficult to assess whether the behavior of such children is normal or sufficiently problematical to require intervention. Judgment will need to take into account the frequency, range, and intensity of symptoms and the extent to which they cause impairment. Habit disorders. The term habit disorders includes thumb sucking, nail biting, hair pulling, and tics, such as shoulder, head, and elbow jerks, eye blinking, twitching or squinting of the eyes, and jerking of the mouth and cheek. These include a range of phenomena that may be described as tension reducing. All children will at some developmental stage display repetitive behaviors, but whether they may be considered as disorders depends on their frequency and persistence and the effect they have on physical, emotional, and social functioning. These habit behaviors may arise originally from intentional movements, which become repeated and then become incorporated into the child's customary behavior. Some habits arise in imitation of adult behavior. Other habits, such as hair pulling or head banging, develop as a means of providing a form of sensory input and comfort when the child is alone. Thumb sucking. This is quite normal in early infancy. If it continues, it may interfere with the alignment of developing teeth. It is comfort behavior, and parents should try to ignore it while providing encouragement and reassurance about other aspects of the child's activities. Tics. These are repetitive movements of muscle groups that reduce tension arising from physical and emotional states, involving the head, the neck, and hands most frequently. It is difficult for the child with a tic to inhibit it for more than a short period. Parental pressure may exacerbate it, while ignoring the tic can reduce it. Tics can be differentiated from dystonias and dyskinetic movements by their absence during sleep. Stuttering. This is not a tension-reducing habit. It arises in 5% of children as they learn to speak. About 20% of these retain the stuttering into adulthood. It is more prevalent in boys than girls. Initially, it is better to ignore the problem since most cases will resolve spontaneously. If the disfluent speech persists and discussing concern, refer to a speech therapist. Anxiety disorders. Anxiety and fearfulness are part of normal development. However, when they persist and become generalized, they can develop into socially disabling conditions and require intervention. Approximately 6 to 7% of children may develop anxiety disorders, and of these 1 to 3 may be over-anxious, while 1 to 3 may have some phobia. Generalized anxiety disorder, childhood onset social phobia, separation anxiety disorder, obsessive compulsive disorder, and phobia are demonstrated by diffuse or specific anxiety predictably caused by certain situations. School phobia occurs in 1 to 2% of children, of which an estimated 75% may be suffering some degree of depression and anxiety. Management is by treating underlying psychiatric condition, family therapy, parental training, and liaison with school to investigate possible reasons for refusal and negotiate re-entry. 5.3.1 Disruptive behavior. Many behaviors are probably undesirable, but a normal occurrence at an early stage of development can be considered pathological when they present at a later age. In the young child, many behaviors such as breath holding or temper tantrums are probably the result of anger and frustration at their inability to control their own environment. For some of these situations, it is wise for parents to avoid a punitive response and, if possible, to remove themselves from the room. It is quite likely that the child will be frightened by the intensity of their own behavior and will need comfort and reassurance. While some isolated incidents of stealing or lying are normal occurrences of early development, they may warrant intervention if they persist. Truancy, arson, antisocial behavior, and aggression should be considered as normal developmental features. 5.3.2 Attention Deficit Hyperactivity Disorder. This is characterized by poor ability to attend to tasks, e.g., makes careless mistakes, avoids sustained mental effort, motor overactivity, e.g., fidgets, has difficulty playing quietly, and impulsiveness, e.g., blurt out answer, interrupt others. For the diagnosis to be made, the condition must be evident before age 7 years, present for 6 months, seen both at home and school, and impeding the child's functioning. The condition is diagnosed in 3 to 7% of school-age children. Methylphenidate, initiated by specialists only, is a stimulant medication that provides reduction of symptoms, at least in the short term. Management usually includes family therapy, a program of behavioral modification for the child and the parent, although further research confirming its benefit is needed. Essential fatty acids may alleviate some symptoms. Sleeping problems. Sleep disorders can be defined as too much or too little sleep than is appropriate for the age of the child. By the age of 1 to 3 months, the longest daily sleep should be between midnight and morning. Sleeping through the night is a developmental milestone, but at the age of 1 year, 30% of children may still be waking in the night. Stable sleep patterns may not be present until age 5 years, but parental or environmental factors can encourage the development of circadian rhythm. Sleep disturbance can have a deleterious effect on the cognitive development of children, as well as the functioning of the parent. One study of 2 to 3 years old found a significant link between sleep disturbance and emotional and behavioral disorders. Other links include memory loss and obesity. Regular bedtimes, quieter activities, and the creation of marked differences between the sound activities and light levels associated with nighttime sleeping and daytime activities may help to encourage better sleep patterns. A solid evidence-base now supports the use of behavioral treatments in infants and preschool children under 5. All of these are based on the objective of the parent gaining control of the bedtime routine. They include unmodified extension, ignoring the child's cries but monitoring for illness or injury. Modified extension, ignoring the child for a specified period of time. And positive routines, doing some quiet pre-sleep activity and ensuring that falling asleep is associated with a positive parental-child interaction. One study found that parental interventions that encourage independence and self-soothing were associated with extended and more consolidated sleep compared to more active interactions that were associated with shorter and more fragmented sleep. Hypnotherapy has been found to be of benefit in school-age children. The BNF for children states that the use of hypnotics, except for occasional short-term treatment of night terrors and sleepwalking, is never justified. However, it is recognized that the treatment of pediatric insomnia is an area that needs further research. Melatonin is sometimes of benefit in sleep disorder associated with visual impairment, cerebral palsy, attention deficit hyperactivity disorder, and autism. It is unlicensed for this indication and specialist supervision is recommended for initiation and monitoring. Summary. 1. A psychosocial disorder is a mental illness caused or influenced by life experiences as well as maladjusted cognitive and behavioral processes. Psychological disorders are manifested as disturbance in emotions, behavior, physical function, mental performance. 2. The term habit disorders includes thumb sucking, nail biting, hair pulling, stuttering, and tics. such as shoulder, head, and elbow jerks, eye blinking, twitching or squinting of the eyes, and jerking of the mouth and cheek. 3. Anxiety and fearfulness are part of normal development. Many of these disruptive behaviors are probably undesirable, but a normal occurrence at an early stage of development can be considered pathological. Attention deficit hyperactivity disorder is characterized by poor ability to attend to tasks, motor overactivity, and impulsiveness.